Hi, my name is Scott. I have a practice called My Brain Mechanic, and brain health, gut and brain health are my absolute passion. I'm a survivor of a brain injury, and I've been in functional medicine for 30 years. Today, I want to talk to you about a vitamin called K2. But before I talk about K2, I want to talk about strokes and heart attacks and what causes them. And I am also going to get to brain injuries, so that's why it would be in the title, but give me a moment to get there. So the reason why we have a stroke or a heart attack is that we have calcification of an artery, and that calcification comes from calcium. So a woman who has osteoporosis has a 2 to 3 times greater chance of having a heart attack and a 1.5 to 2.5 fold increase of a stroke. So now imagine if you're taking calcium to try and fight the osteoporosis, the increased risk that you have of having a heart attack or a stroke. Thank God vitamin K2 was discovered, and it was discovered in Japan from a diet out of natto, which is a fermented diet, and it's disgusting, so it's much greater to be able to take it in a pill. So vitamin K2 does some amazing things, and what is known for primarily right now, but all this new research is coming out about the brain, and that's why I bring brain injuries and strokes in there. So this GLA matrix that gets activated drives calcium into the bone, helps clear up those arteries, get rid of that calcium. And then in our brain, we have a 400-mile long microvascular network that's supplying blood and oxygen to our 86 billion neurons. So just the slightest bit of calcification can really do some damage. In fact, a lot of people have mini strokes and don't even know it until they have a full-blown stroke. The other thing I want to talk about before I get into some of the other things about stroke recovery and brain injury recovery is, one, obviously, if you're going to take calcium, please take it with K2. And more companies are incorporating it into their calcium now. But it's also important to realize if you're on a blood thinner, it cancels out K2. This is an interesting story and kind of sick in a way, because warfarin or Coumadin, the original blood thinner, is rat poison. They used to use it to bleed out rats, and then it became a medication. So, I'm very, very impressed in some of the drugs that we have, and some of them are absolutely incredible, but there are a lot of drugs that just treat symptoms or really aren't doing what they should. In fact, this is another interesting thing. Antibiotics, most people think about when you take an antibiotic that you want to take a pre or probiotic to re-inoculate your microbiome, but vitamin helps to block antibiotics from destroying neurons in your hippocampus. So vitamin K2, along with driving that calcium into the bones and helping that microvascular network get cleared up, is absolutely essential for stroke recovery and brain injury recovery, because that blood flow and getting oxygen and blood and nutrients, that 400-mile long network is absolutely essential. But it also activates what are called sphingolipids, and these are cell membranes, and it helps with the cell survivability and cell transmission, transmitting information back and between cells. It also activates a GAS6 gene, which is responsible for brain cell growth, apoptosis, and myelination. And again, myelination is helping with that nerve conduction, that neuronal connectivity. So we've even looked at some studies showing that it helps prevent the buildup of amyloid plaque, which is, of course, what's associated with Alzheimer's. So there are amazing more findings now on vitamin K2 just beyond heart and bone health as it relates to cognitive health in terms of preventing strokes, stroke recovery, and brain recovery. My name is Scott. My practice is called My Brain Mechanic. In my website, which is up in the upper right corner on my YouTube channel, I do free consults from 1 to 4 o'clock Pacific Standard Time every Thursday. I'm one of the few practitioners that does that. I do it because I'm also a brain injury survivor, and it was hell coming back, and I didn't know who to turn to until I finally found help. And I've been in an industry for 30 years and knew quite a bit, but I had to find some very unique individuals in what's called functional neurology, which is now my specialty. So I want to be that open line of communication to you, whether you work with me or with someone else, just to give you some of the latest information in science, because really in the last 8 years we've learned so much. If you are going to take calcium, please make sure to take K2 with it. There are more studies coming out now. It will help prevent heart attacks and strokes. It's essential in brain health, stroke recovery, and brain injury recovery.